Okay, in this presentation, I'm going to go over how stretching might be beneficial for cardiovascular health. So we usually use stretching, as part of our warm-up to increase flexibility and to prevent muscle injury. But there's been some recent research that shows that it might actually be beneficial for your blood vessels, and this can affect your risk for cardiovascular health. So it might be effective for actually reducing your risk of cardiovascular disease. So with this presentation, I'm going to first go over some physiological mechanisms to explain why stretching might be good for the health of your blood vessels and your cardiovascular system. And then I'll go over a recent study we did where we compared stretching exercises to a traditional walking program. So usually walking is prescribed to people that have elevated blood pressure. And then at the end, I'm going to go over some practical recommendations. So physiological mechanisms by which stretching might be beneficial for cardiovascular health. So this diagram outlines how your vascular system looks, or the blood vessels throughout your body. So on the left-hand side, you see your aorta. That's the big blood vessel that leaves your heart. And then you have arteries and arterioles that go to your muscle. They deliver blood that's rich in oxygen to your muscles. Then you have capillaries, the smaller blood vessels that surround your muscles. Then you have veins, venules, veins, and vena cava that go back to the heart. And the blood in that portion is low in oxygen because your muscles are consuming oxygen, especially during exercise. So the key here is that when you stretch a muscle, you also end up stretching all of the blood vessels, in the limb that you're stretching. And when you stretch these blood vessels and you do it chronically over a period of time, there's actual changes in the cellular makeup of these blood vessels. So there's been some animal studies. In this case, they've taken some arteries from rabbits and they've stretched them. And they notice that if they're chronically stretched, you actually see a change in the turnover of the cells that make up those arteries. That change in turnover of the cells end up making the arteries less stiff. So if you have a stiff artery, it becomes more resistant to blood flow. So if you can stretch an artery and reduce its stiffness, you'll have less of a resistance to blood flow, and that in turn would decrease your blood pressure. So your blood pressure is largely determined by the stiffness of your arteries and the resistance to blood flow. And as we age, our arteries become stiffer, they become more resistant to blood flow, and that in turn drives up your blood pressure. This is just another specific study, again in animals, looking at old rat hind limb where they chronically stretched it. And with an animal experiment, you can really take apart the muscle afterwards and look at the changes. So that first graph on the left shows that the number of capillaries were increased in muscles that were stretched. Those are the small blood vessels that surround your muscles. And so with an increase in those blood vessels, you're going to have greater blood flow, less resistance to flow, and that's going to decrease your blood pressure. The graph on the right shows that you have increase in production of some of the metabolites in your blood vessels that actually cause blood vessels to dilate. So this allows the blood vessels to actually increase in diameter. And again, this increases blood flow, reduces resistance to flow, and that in turn could reduce your blood pressure. Some studies with humans, you actually get changes in the way your nervous system is activated when you stretch your muscles. So you have these receptors in muscle that get activated when you actually stretch the muscle. When you activate those receptors, in the period after a stretching exercise, you get increased activation of a part of your nervous system that makes you more relaxed. And this could be another reason why you might get a decrease in blood pressure. from performing stretching exercises. It's because you're activating a part of your nervous system that makes your whole body feel more relaxed. Another thing that's noticed after a period of stretching is that blood flow is increased. Again, this might indicate that you're releasing metabolites within your blood vessels that cause them to dilate or cause them to become, have a greater diameter. And again, this decreases resistance to blood flow, which in turn would decrease your blood pressure. So this is kind of a summary of the physiological mechanisms. If you're stretching a muscle chronically, you might get benefits to the health of your blood vessels because you get structural changes in the blood vessels causing them to reduce their stiffness. You get an increase in release of metabolites that cause the blood vessels to dilate, so this increases blood flow. So you get, again, less resistance to blood flow, and that decreases your blood pressure. Or you might get alterations in the way your nervous system is activated. And this alteration would allow an increased state of relaxation. So I'm going to move on to the study that we did. So with the study we performed, and you can see the citation at the bottom, John Coe was a graduate student of mine who did most of this study, and is published in the Journal of Physical Activity and Health. We wanted to compare a traditional walking program to a stretching program, and this was in people that had high normal blood pressure or stage 1 hypertension. So they had a systolic blood pressure that ranged from 130 to 159, or they had a diastolic blood pressure that was between 85 to 99. And that determined their inclusion in our study. And it was an 8-week program. We had 40 participants, and they were randomly assigned to either a stretching program or a brisk walking program. Each program was done for about 30 minutes per day, 5 days per week, and the whole program was 8 weeks long. Our stretching program involved a lot of stretches, so 21 stretching exercises, and each stretch was done twice for 30 seconds with 15 seconds rest between stretches. So I've got pictures of all the stretching exercises we included. So this is the 21 stretching exercises. These are the exercises for the upper body. So on the top you can see some exercises for the shoulders and the arms. You see one exercise where the person's leaning over. That would be more of a stretch for the chest muscles. On the bottom, you have stretching exercises that include stretching for the lower back. We also included, these are stretches for the lower body, so the calf, the hamstrings, the quadricep. And we also have stretches here for the muscles around the hip area. So we assess blood pressure in 3 different ways. We did the standard just sitting blood pressure. We measured blood pressure while the person was lying down. And we did that because when you're laying down and you're having your blood pressure measured, I think you're just in more of a relaxed state, and there's less variability in your blood pressure readings. And then we also measured 24-hour ambulatory blood pressure. So we had people wear these blood pressure cuffs that are attached to a pack, like a battery pack that's around your waist. And they were required to wear this for a 24-hour period. The blood pressure was measured every 20 minutes during the daytime, so that cuff would inflate and measure the blood pressure every 20 minutes. And then at night, it would inflate and measure your blood pressure every 45 minutes. So 3 different ways that we measured blood pressure, and we did this before and after the 8-week training program. These graphs show the changes in mean arterial blood pressure from before to after the training programs. So the mean arterial blood pressure is just a combination of your systolic and diastolic blood pressure. You can see the top graph represents the change in blood pressure during the daytime. A small change, so a small decrease in the stretching group, and you can see the walking group hardly changed. The biggest change we saw was for nighttime blood pressure. You can see the stretching group really decreased. I'm not sure why the walking group tended to have the increase, but it could be just because of a couple of outliers who had large increases in nighttime blood pressure. This is graphs for the change in sitting blood pressure. You can see at the top, we saw about a 4 millimeter mercury reduction in the stretching group, hardly any change in the walking group. Same with the laying mean arterial blood pressure, so about a 5 millimeter per mercury decrease in the stretching group and not much of a change in the walking group. One thing I want to emphasize is the walking program, despite it not being as effective as the stretching for reducing blood pressure, was that it's still effective for reducing other risk factors for cardiovascular disease. So in this case, we measured waist girth. That gives you an indication of the amount of body fat you have around the waist area. And it was significantly reduced in with the walking program compared to the stretching program. So the walking program still had some beneficial effects. So our summary here is that across all blood pressure measurements, the stretching program reduced blood pressure by about 5 millimeters of mercury compared to the walking program. One thing you might be thinking about with this presentation is that, in our study we had 21 stretching exercises. It's a lot of stretching to do on a daily basis. So I've pulled up this one other study that was recently published that showed about an equivalent reduction in blood pressure as our study. So they showed that with stretching, they had a 5 millimeter per mercury decrease in blood pressure. And they just used stretching of the big muscles of the lower limbs. So they did these stretches a little bit more than we did, 5 times each for 45 seconds. But they just used stretching of the calf, the hamstrings, and the quadriceps. So the key takeaway here is that, I think you could just do those stretches for the big muscles in your lower body on a daily basis and still get a significant benefit for reducing your blood pressure. So overall recommendation is to incorporate stretching into your routine if you are concerned about elevated blood pressure. And one important note is that I wouldn't throw out your aerobic exercise routine because it's still beneficial for reducing other risk factors for cardiovascular disease, such as fat around the waist in our study, but it's also probably beneficial for reducing your cholesterol levels and your blood sugar levels. And I just want to end here by acknowledging first the students that helped out with this study. So John Coe was a master's student in my lab. Dalton Deprez was a summer undergraduate student. Keely Shaw is my PhD student. And then a few of the professors that helped out with the study as well. Dr. Jane Alcorn from the College of Pharmacy and Nutrition. Dr. Thomas Havenstrabopoulos from the University of Regina, and Corey Tomczak and Heather Folds from the College of Kinesiology at our university. And the study was funded by the Saskatchewan Health Research Foundation and the Canadian Institutes of Health Research.